a deadly pandemic which exposed the lack of preparedness of many healthcare providers to offer appropriate end-of-life care to patients and to families, and just really addressing the urgent needs to raise awareness, just through multiple benefits of early referral to palliative care. The theme for this year's conference is Palliative Care is Everyone's Business. I absolutely love that. Now, the conference program highlights the multidisciplinary nature of the palliative care sector and its just accessibility to all. Joining us right now to expand and give us some more details about this year's Palliative Care Conference, her name is Julia Ambler. Welcome to the show, and thank you so much for joining us.
Thank you. This is a wonderful opportunity to be with you.
It's just so interesting, I think it's sometimes scary for people to think about something like palliative care. So can we jump into just a quick definition, especially for our younger viewers at home? What exactly is palliative care?
So palliative care really is about comfort care. It's about focusing on someone's quality of life. When you get diagnosed with a very serious illness, it's stressful, it's scary, it's expensive, it's emotional, and it's painful. So palliative care aims to manage all of that, helping people to feel better and cope better with whatever they've got to face. So it's really another layer of support in serious illness.
So I know that you're also involved in a children's palliative care unit of sorts. Can you expand on what your role is and what exactly you guys focus on?
So we run, I'm the clinical director of an organization called Ambler Hospice Care for Children. We're based in KZN, and we look after children that are diagnosed with serious illnesses. So some kids might have neurological problems, some kids might have liver issues, cancer. Whatever the illness is, we will be there to support those families right from the time of diagnosis through, and if the child dies, we will be there as well to make sure that that is a peaceful, comfortable, and dignified time.
It's something that is it's sometimes so uncomfortable to talk about something like that, but it just shows you the reality is people need that. And it's horrible for somebody to just think about, that person needed that care towards the end of their life and nobody was there. So I think what you're doing is so beautiful and so admirable.
Thank you.
And I love that there's a conference because it really is creating a platform. So tell us all about the conference.
So it's been a while since we had one in South Africa, and now this is the first of its kind. It's 3 big palliative care organizations in the country covering every sector of palliative care, coming together at the Vineyard Hotel in Cape Town for 3 days this week. And we've got some international speakers, but mostly local experts coming together. It's going to be great. We're so excited because it is hard work. It's emotionally tough. And we really just need to know that each other's out there and to network and share resources and ideas, because sustainability is a huge issue. Funding is a big issue for palliative care. It's mostly in the NGO sector, which makes it really, really hard. So this conference is bringing together that theme, keeping it relevant, looking at sustainability, making sure that we really kind of looking at how we can make palliative care more accessible to more people in South Africa going forward.
It really is such an important conversation. Can you repeat those dates again? I believe it ends on the 29th of April, right?
Yeah.
So
26th to the 29th of April.
So guys, especially if you're at home, maybe you've got a family member that's involved in that industry, just taking care of other people, especially towards the end of their life, let them know that the conference is happening. Again, Julia was saying 26th to the 29th of April. Now, you mentioned, the conference overall. It is a beautiful sounding platform. 3 days, it shows you, there's a lot of effort, there's a lot of opportunity that has gone into it. What are some of the sort of missions and goals beyond what you already mentioned that you really want to achieve with this conference?
Well, I think it's highlighting the need and making the public aware that there is a need and that there is such a thing. So when you have a loved one at home that is really sick, or you're feeling isolated, lonely, stressing, that you've got someone to phone, that you can understand that there are people out there that are trained, very professionally trained to do this work alongside whatever other treatments you're having. So if more people can understand what palliative care is, the more people will access it. And that's really our main goal, is that more South Africans get palliative care.
I mean, it makes a lot of sense. It is something that people need access to, regardless of whether or not it's a bit of uncomfortable conversation. It is so, they say you haven't lived life until you've changed somebody else's. And I can't imagine a better example than something like palliative care. What would you say is any sort of misconception about palliative care that people might have?
people think it's about dying and death, and actually it's about living. It's about living well with your conditions. So whatever you've got, it's looking at what are the things that we can do to support you to live a better life with whatever it is you've got going on.
Yeah.
So it's really about quality of life and relieving the suffering that patients experience when they're seriously ill. And it's definitely not only about end of life, and that is such a big message. You know, early palliative care really makes a difference. Actually, there's research that says patients live longer when they access palliative care early.
So I love that even I'm learning a little bit more about palliative care. Now, for people who are at home, especially if it's maybe, you know, somebody that is involved in that sector, how can they get involved in the conference? Who do they reach out to? What's all those details?
So we're on social media, and certainly there's a conference website, South African Conference 2023, Palliative Care. People can look it up, they can look at the program, see what speakers are out there, possibly attend even if there are sessions that they are deeply interested in. But we'd really like people to understand what's out there. Yeah.
So guys, you heard it straight from Julia. Just take a quick Google, Google the Palliative Care Conference. It really sounds incredible. The fact that it's 3 days, I feel like there's so often these amazing conferences that happen, but then they're just one day. And it just really doesn't spark the opportunity platform that it really could. So it's pretty impressive to hear. And it's not a sector that I'm involved in, but I do know that when it comes to healthcare, especially post-pandemic, I think we're all sort of shifting our view and trying to understand more. So guys, again, 3 days, Palliative Care Conference at the Vineyard Hotel. So a very, very nice location as well. It's straight in the heart of Newlands, and it's happening from the 26th of April to the 29th of April.